Now to the Ebola crisis, Liberian President Ellen Johnson Sirleaf is ending the state of emergency she instituted because of the Ebola crisis. Ms. Sirleaf said Thursday the fight against Ebola is not over and that some restrictions will remain in place. Meanwhile, members of the U.S. Senate Appropriations Committee questioned top U.S. health officials on what needs to be done to protect Americans from the Ebola virus. Here is the first of two reports from VOA's Zlatica Hoke on the crisis.
Maryland Senator Barbara Mikulski, who chairs the committee, said most Americans agree that Ebola must be fought at its epicenter in Liberia, Guinea and Sierra Leone.
We have to have a strong worldwide public health effort, vaccines to prevent diseases, therapeutics to treat diseases, the people and the infrastructure to do that.
Mikulski said the Ebola outbreak meets the criteria for emergency spending because it is sudden, unforeseen, urgent, and temporary. Alabama Senator Richard Shelby, ranking Republican on the committee, criticized what he called a confusing and at times contradictory U.S. government response.
For example, the CDC's guidance to hospitals has been a moving target. This uncertainty may have exposed healthcare professionals to unnecessary risk.
The CDC defended its actions, saying Ebola's ebbs and flows are unpredictable.
We see different trends in each of the three countries, and within each of the three countries, different trends in different areas.
A Department of Defense official said the U.S. military's response to the Ebola threat was fast, comprehensive, and effective.
The Department of Defense's interim measures are an essential element of the U.S. response to lay the necessary groundwork for the international community to mobilize its response capabilities.
The administration also defended its decision not to ban visas for citizens of Ebola-stricken countries.
My biggest concern with limiting the number of visas is that if the United States of America does that, a lot of other nations are going to follow us, which will have the effect of isolating those countries, which I don't think we want to see happen.
Health officials have pointed out there has been progress in the fight against the virus since the last congressional hearing.
The next is that we've made a significant progress on the road to the testing of a vaccine for its efficacy, because we had just started the phase 1 trial at the time of the last hearing, and now the results look good in that trial.
Both the administration and health officials said the battle against Ebola is far from over. They said the additional emergency funds are essential to stop the virus from spreading to neighboring countries and beyond.
While Liberia, Sierra Leone, and Guinea have borne the brunt of the epidemic, we have also seen cases in Mali, Nigeria, Senegal, and Spain. And of course, isolated cases in the United States highlight the U.S. national security implications of this epidemic.
About 50 organizations weighed in on the discussion with written testimonies supporting the spending and saying budget cuts have damaged U.S. preparedness. Zlatica Hoke, VOA News, Washington.